Picture of anterior group. Так, boys. Muscles of anterior. On this picture, on the forearm, arm, shoulder girdle, this is anterior surface. When my arm in position supination. When you see the pictures on the model, on the atlas, we use position of arm only supination. So this is anterior picture and this is posterior picture. So shoulder girdle, this is musculus subscapularis and this is musculus coracobrachialis. Yes, anterior group. And posterior group deltoid muscle, contouring the border of shoulder, musculus deltoideus. Then this is spina scapula. So this is musculus supraspinatus, infraspinatus. This is teres minor, this is teres major. Yes, this is teres major. About shoulder girdle. This is shoulder girdle questions. Not, I think. And arm, two group, anterior, posterior. Two muscle in anterior, two muscle of posterior group. This is musculus biceps. One caput, two caput. This is long caput, begin at the tuberculum supralendalis. This is short, begin at the coracoid process. You can see it from coracoid process, begin to muscle, short head of biceps and musculus coracobrachialis. And second muscle, this is musculus brachialis.
Musculus anconus.
This is anterior surface. Why not? Brachialis. This is anterior. Remember, this is only anterior. This is only posterior. Musculus biceps brachialis and musculus brachialis. And posterior picture is this. Musculus anconus not present. You can't. Anconus, yes. We can see big. Musculus all of this. Musculus triceps brachii. Yes. And if we say about, firstly go to the body, I show you muscles on the body. Shoulder and arm. And topography. Так,
इसका हाथ उठा हुआ है देख नहीं करेगा वो मारेगा पकड़
what the muscle? For the muscle. Yes, all see big muscle. All of this musculus subscapularis. Yes, this muscle.
musculus deltoideus
Yes, musculus deltoideus. Then
समझ में नहीं आता
सब तो एक जैसे दिख रहा है
हाँ ना वही तो
this is coracoid process of scapula. So this is musculus coracobrachialis. All see this is coracoid process of scapula. This is musculus coracobrachialis. And this is two caput of musculus biceps femoris. One caput begin at the coracoid process and second caput tuberculum supraglenoidalis. Yes. This is quickly anterior group. Brachialis.
Brachialis.
This is brachialis. So two muscles of arm. This is brachialis.
biceps
Brachii. Yes. This is coracobrachialis and posterior
musculus triceps
triceps for boys from this side. This is musculus triceps. Anconus, no, should be small muscle. Anconus. So, так, arm show. And if we say about shoulder girdle, two muscle anterior, I show you musculus subscapularis, 1, 2, musculus coracobrachialis. And firstly, I show for your half, and then for your. If we take Are you hear the sound? This is spina scapula. So this is musculus supraspinata, infraspinata, Then this is teres minor, teres major. And then for you, this is spina scapula. This is musculus supra. This is spina scapula. This is musculus supra spinatus, musculus infra spinatus, musculus teres minor, and musculus teres major. Again. This is spina scapula, yes. This is musculus supraspinatus, infraspinatus, teres minor, teres major. No, they like on the picture, from up to down. Supraspinatus, infraspinatus, teres minor, teres major. Yes. Так, ну, and deltoid, no, this is big. All of this, deltoid. Attached to tubuloides deltoide of humerus. All of this big. Musculus deltoideus begin clavicula, spina scapula, and the acromion of scapula. Musculus deltoideus. Так, muscles, arm, shoulder, girdle, understand? Yes. And in this topic, you should know the topography. We have the live human have the axillar fossa. And this body have axillar cavity because we delete skin, fat, so this body have axillar cavity. This is axillar cavity, but we have axillar fossa, and you should know foreborder of axillar cavity. In front, located two muscle, musculus pectoralis major, musculus pectoralis minor. Behind, musculus subscapularis, then musculus teres major, and musculus latissimus dorsi. Yes. The medial border, what the muscle? Serratus anterior, musculus serratus anterior, and lateral wall, surgical neck of humerus. Yes, serratus anterior, this is muscle, yes. So medial border, serratus anterior, lateral border, surgical neck of humerus. Understand? For wall, in front, behind, medial, lateral. Revise, behind. Front, behind, this is back, yes, back, musculus subscapularis, musculus teres major, and latissimus dorsi. In front, pectoralis major, pectoralis minor, medial, serratus anterior, lateral, humerus, surgical neck of humerus. And behind, if we look at the picture, on this picture, we can see we can see two foramen, one and two. This is foramen first, trilaterum, half revolve, foramen trilaterum, and this is foramen quadrilaterum. And you should know the border. If we have about foramen trilaterum up, located musculus subscapularis, below, teres major and long caput of triceps brachii. Understand? Free wall. Subscapularis behind, or not behind, above, below teres major and long caput of triceps brachii. Yes. And foramen quadrilaterum up, teres minor, down, teres major, long caput of triceps, and surgical neck of humerus. Understand? Borders of axillar cavity, and these two foramen stitch. Because when we discuss the vessels, some vessels passes from this foramen, and I can ask you the borders. Foramen trilaterum, and quadrilaterum. No, in Moodle all of this is writing. And the last topography of this topic, if we... Так, может быть. Who can give me atlas, please? Red, firstly for you. Так, boys, look. This is foramen. Are you see my wizard go? Foramen, Так, boys, why you not? I ask you. What is this? Laterum. For this side and for girls. This is foramen quadrilaterum. Yes, так. Так, сейчас. 1 second. To foramen, trilaterum, up musculus subscapularis, below teres major, and long caput of triceps femoris, trilaterum. And foramen quadralaterum, up teres minor or subscapularis. You can say two variants. Below this is teres major, long caput of triceps, and surgical neck of humerus. Yes. And where show you? And if we say about axillary cavity in front, we can see a free triangles. Where show you? This, yes. All in front we can see free triangle, and you should know, if I not find. Так, сейчас. Ладно. Clavi, pectorale. I remember musculus pectoralis minor on the chest. This triangle located between clavicula and musculus pectoralis minor. Trigonum clavi pectorale. Second triangle, trigonum pectorale, corresponded to the borders of musculus pectoralis minor. I remember we see musculus pectoralis minor on the market. This triangle borders of musculus pectoralis minor, and the last triangle, trigonum below subpectorale, located to the lower surface of pectoralis major and pectoralis minor. Understand? Borders of triangles studied. And topography of. And if we say about muscles of arm, behind we have a canalis radialis. I remember on the humerus sulcus nervi radialis. Who remember? Have spiral direction. So humerus, and above located the muscle, musculus triceps brachii, and between bone and muscle located the canal, canalis nervi radialis, or second name canalis spiralis. Spiralis because have a spiral shape. Yes, canalis nervi radialis. In this canal passes the radial nerve. The borders of this canal, humerus on one side and musculus triceps brachii second. Because going the humerus and muscle surrounding the bone, and between located the canal, canalis nervi radialis, or spiral canal. Yes, spiralis canal. Так. And about topography of arm and shoulder girdle, this is all. Axillary cavity walls, free triangles, two foramens, and canalis nervi radialis. Questions? Нет. Хорошо. Так, and today we discuss muscles of